Welcome to the Road to Recovery, Hope and Healing in Mental Health. Joining us today is Dr. Paul Erickson, Medical Director for Psychiatry and Addiction Medicine at Cottage Health, and Dr. Margaret Ballman, Medical Director for Psychiatry and Addiction Medicine at Cottage Health's San Luis Obispo outpatient program. Today we're talking about what is a mental health disorder. So we'll begin with our first question. What is good mental health in school, work, or even in relationships?
Well, that's a tough question. It encompasses so many aspects of our lives. It's the ability to function well in basic things, school, work, happiness, and functioning well in relationships, and able to work through difficult problems is a big one.
Sure. Dr. Erickson?
I think of it as similar to good physical health. It's feeling well and doing well in your life. And in mental health, that means particularly in how you're thinking and feeling and behaving and having relationships. Those are the basics of good mental health.
So let's talk about what is a mental health disorder or problem.
So a mental health disorder is a problem in one of those spheres that I was just describing. When somebody's mood or anxiety or thinking or behavior becomes a problem for them, then that can be a mental health disorder. And a problem might mean that either they're feeling subjectively distressed by how they're doing, or how they're performing in life is suffering.
You can tell sometimes by, as Dr. Erickson is saying, how one feels. Are you distressed by it? Are you worried or upset about it? Are those you love expressing concern about it? Or are you seeing concrete things happening? You're not doing it as well in school. You're not doing it as well in work, those kinds of things.
And I would add that, experiencing some anxiety or depression is part of normal human experience. It's
Right.
when it becomes persistent and deeper and more disabling that it becomes a disorder.
Sure. So if somebody is wondering, how do I know if I have a mental health disorder, what would you tell them?
So I think that one thing that's very important is to speak up if you have a concern that you're having a problem with mental health. And that might start with people you trust in your life, family or a teacher. But if it's a concern that you really want to have evaluated, what's very important is to find a good mental health professional to talk to.
Find someone who's experienced at diagnosis and who you really can trust to give you a very honest, neutral answer about it.
Sure. How is a mental health disorder diagnosed?
Well, there's several things you go through. Usually, a lot of people are going to go to their primary care doctor first and talk with the primary care doctor. The primary care doctor may have to rule out certain medical disorders that mimic mental health disorders. Low thyroid often looks like depression. So you want to do that first in a lot of cases, and then people may come to see a psychiatrist or a therapist to ask more questions.
And mental health disorders are diagnosed clinically. What I mean by that is that unlike some physical health disorders where there are lab tests or x-rays or imaging tests that can help clarify a diagnosis, by and large those don't exist in mental health. The diagnosis is made based on an interview with the individual, based on their own history, their family history, their current symptoms, and how those correspond to known mental health disorders.
Sometimes it helps, too, with the patient's permission, of course, if a family member perhaps can be brought in to discuss the things that they have noticed perhaps at home with the person.
I've only got about a minute. How would someone find a good mental health professional?
Well, asking your primary care doctor for some referrals, looking to see if you may know people who are seeing a therapist or have worked with someone, getting some names there, seeing if someone is board certified.
So you want to find somebody who has the education and licensing to be a professional in mental health, whether that's a psychologist or social worker or psychiatrist. And you want to find somebody who has a good reputation, and often that is through your primary care doctor or through networking with friends or family.
To learn more or share this interview with a loved one, visit cottagehealth.org/road to recovery. Tune in next week when we discuss anxiety disorders.